So let's quickly look at the bundle branch block and how the bundle branch block can actually show up in what electrocardiography. Like if you do an electrocardiography, how can you be able to diagnose that there's a bundle branch block? Okay, and before that, what is even this bundle branch block that people actually talk about? So in talking about this, we'll actually be defining what a bundle branch block is. We talk about the causes of bundle branch block and what conditions can actually bring about this bundle branch block that we're talking about. Then if there's a bundle branch block, what will be the symptoms? Okay, then how can you be able to diagnose a bundle branch block? Okay, so all of that, then treatment of bundle branch blocks and the complications. So basically talk about everything that has to do with what bundle branch block. Okay, so we said that bundle branch block is actually a condition where there's a delay or blockage in the electrical conduction through one of the bundle branches in the heart. Okay, so this will actually affect the ventricles' ability to contract, okay, in a coordinated manner. All right, so the ventricles will now start misbehaving, contracting irregularly, and all that. Okay, so the types of bundle branches that we have things like what the left bundle branch block. Let me remind you guys about the anatomy. So the bundle branch is, you could say this is the right one, okay, and this is the left one. Okay, are you feeling me? All right, so now you can see that the right one there's still conduction, that's why you see a green arrow, but on the left one the conduction is stopping here, show that there's a block. Okay, so that one is a left bundle branch block. Okay, so it could actually occur on the left side, could also occur on the right side. It could be bifascicular. That means what? The right side is blocked and the left side is blocked. All right. It could be trifascicular. That means there's a left side block, right side block, and the first degree what? AV block. That's the atrioventricular block. What are the possible causes of what? These blocks, these bundle branch blocks that we have? It could be ischemic heart disease. It could be cardiomyopathy. All right, it could be hypertension, it could be valvular heart disease, it could be congenital heart disease, it could be electrolyte imbalance, it could be cardiac tumors, it could be trauma. Okay, so any of these conditions can actually what cause a bundle branch block. Then talking about symptoms now, yeah, if there's a bundle branch block, okay, what will it result to? So it could result to things like shortness of breath, fatigue, chest pains, palpitations, dizziness, syncope, that's fainting. All right, diagnosis, you could use the electrocardiogram to diagnose this. You could use the echocardiogram to diagnose this. You could use the cardiac catheterization to diagnose this. You could use what the electrophysiology study to diagnose this. All right, so talking about the possible treatments now, you could give medications like what beta blockers and anti-arrhythmic drugs. Okay, then you can also give what pacemaker implantation, like all those implantable devices to manage heart failure. You can also give what cardiac resynchronization therapy. You could do a coronary artery bypass, which is basically the surgical part. Then you can do the heart transplant if the cases are basically what severe. All right, then talking about complications, if a bundle branch block is left untreated, it can lead to things like what heart failure, arrhythmias, which is irregular heartbeats. It could lead to sudden cardiac death. It could lead to what cardiac arrest. Okay, so that's it about bundle branch block in electrocardiography. All right, basically the types, causes, symptoms, diagnosis, treatment, and complications.